Okay, so on this video, what we're going to go through is the overstructure of the heart, and then basically the contraction and basically the cardiac cycle of the heart as well. So this picture you can probably see a lot of, and this shows the overstructure of the heart, and so you're expected to know the four chambers. So the atria on top, the ventricles on the bottom, you expect to know the blood vessels that connect to them. So the vena cava, pulmonary artery, pulmonary vein, and the aorta. And you expect to know the name of these valves, which are the atrioventricular, these ones here, and then this one here is the semilunar valve. So you can see on this diagram is basically the complete run through of the diagram. So if we take it from the blood returning back from the body, so the vena cava has a superior and an inferior section here, and they both empty into the right atrium. The right atrium, when it contracts, forces the blood through this atrioventricular valve into the right ventricle. The right ventricle then contracts, pushing the blood up here, and that goes through the semilunar valve up through the pulmonary artery. You see that this pulmonary artery's got two branches. This one goes obviously to each lung. The blood then goes to the lung and then returns back to the heart through the pulmonary vein through these sections that you see here, and they both empty into the left atria. The left atria then contracts, forcing the blood through again the atrioventricular valve here into the left ventricle, and the left ventricle then contracts, forcing the blood into the aorta that you see here. So this section here would then descend down into the legs and the lower limbs, and then you've got these several branches coming off here, going to the arms and then up to the head as well. Okay, so in the lesson, what's going to happen is you're going to be expected to label it. So you're going to have this sheet printed, so you're going to be expected to basically label up the different sections. So that's what the expectation is. Right, in terms of what we're going to look at is this diagram, which is going to show the cardiac output. So if I click on this link, it should take me into the actual diagram. Great, so it looks like this. So, okay, let's pause for a second and let's take a look at what we see here. First up, you've got the diagram of the heart that you see here. Again, atrias, ventricles, the different blood vessels being labelled here as well. And then what you've got here is the pressure graph, which is, you're going to see a hell of a lot of this. So on the pressure graph, and on each of these graphs, you've got the time along the x-axis, and this shows the pressure in a particular area. And so the three lines that we're really interested in here will be this gold line, which will be the pressure in the atria, the red line, which is the pressure in the ventricles, and then the green line, which is the pressure in the aorta. So on this graph, a couple of things that need to be kind of discussed. First of all, this is done from the perspective of the left side of the heart. So you'd get an identical, pretty much a near identical trace on the right side, except the pressures will be lower by virtue of the fact that the left side of the heart is much larger, has to pump to basically a bigger place, to a larger extent around the body, and so therefore it requires higher pressures. The right side only pumping to the lungs, therefore isn't as big. So this trace is always done from the perspective of, in this case, the left side of the heart. Underneath here you've got the ECG, which shows our PQRS waves. Now we're not going to deal with that in today's video or today's session, so we'll leave that for a while. It's this one specifically that we're interested in. So if I play this through first, so this shows the cardiac cycle, and in the cardiac cycle there are three major sections. You've got atrial systole, and systole means contraction. You've then got ventricular systole, and then you've got a term for diastole, which means relaxation. So what we're interested in is what's happening to the heart at different points. So I'm going to stop this, or we're going to go from the top here. So on this first section, I'd like you to pay attention first of all to the pressures at these different points. So we would term this section as atrial systole. So this is where the atria are contracting. They're forcing the blood that's returned into them and through this atrioventricular valve. So this blood vessel, this chamber is going to contract, and we know that it's contracting because you can see here the pressure line for the atria is greater than the pressure line than for the ventricle. And so because the pressure is higher in the atria than it is in the ventricle, this valve, the AV valve that you see here, is open. And so therefore, the blood will flow from this area down to here, or from here down to here. Now what will happen is once atrial systole is completed, we get to this phase. So what's starting to happen now is the ventricles are beginning to contract, and so you can see this is contracting because what is effectively happening here is the pressure inside the ventricle is getting really big. So it started off quite low here and it started rising up, and so the muscle wall of the ventricles here is beginning to contract, reducing the volume in here, so up in the pressure, and you can see the pressure in the ventricle is rising. Now at this point, if you look at this, then we've stopped at exactly at this point. Now, this AV valve is shut, so the job of the valves is to stop the backflow of the blood. So when this one is contracting, and we're at this time point here, then what's happening is the pressure in the ventricle is higher than it is in the atria, so this AV valve is snapped shut. So during ventricular systole, which is basically this phase that we see here, so running from about 0.1 to about 0.3 here at the peak, you get that point, then what you can see is this AV valve is shut. Now interestingly, if we just run this back slightly, at that point at which those two lines cross over, what that effectively is will be that valve closing. And that budum sound that you hear of the heart, so budum, 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 those sounds are either the atrioventricular valve shutting or the semilunar ones shutting. So if we run this forward slightly, now something here has happened. If we look at the aortic pressure line and compare it to the ventricular line, you can see that at this point, just at this point, these two lines have crossed over, which means that the ventricular line has a higher pressure than, in this case, the aorta. So if we're comparing the left side here, so when this one is contracting, the pressure is greater in here than it is in here, and so therefore this valve is now opened, and so therefore the blood is going to flow from the ventricle out into the aorta. Now if we run this forward, so this is all considered ventricular systole because it's contracting. Now what happens once we get to this point? So the ventricle has stopped contracting at this point, and what you can see here is the pressure lines for the aorta and the pressure lines for the ventricle have crossed over again. And so what this means is the pressure is greater in the aorta than it is in the ventricle. And what this will mean at this point is that valve, that semilunar valve, is now shut because the pressure is greater here than it is in this section here. And so we can see where these lines cross over here, this bit indicates the SL valve shutting here, and the AV valve, the SL valve opening here. Now as we play this forward, and the pressure within the ventricle has dropped, so we're now in diastole at this point. So diastole means relaxation, and we consider all of the chambers to be in diastole at this point, atria and ventricles. Now something that's going to start happening is the blood is going to start coming back into these two atria, so they're going to come back from the body in the vena cava, and they're also going to come back from the lungs in the pulmonary vein in this case. And so what's going to happen is our atria are going to begin to fill up, but if we play this forward slightly, you can see at this point the pressure is now greater in the atria than it is in the ventricle. And so what we're going to get at this point is some of the blood moving into this section. So it's going to move from the atria into the ventricle, and we know this because these lines have overlapped. And so if we keep playing this forward, you can see that even though it's in diastole, the atria isn't contracting here. What's happening is because of the returning blood, the pressure has been raised in the section, and the pressure is greater in here than here. So you're going to get atrial filling and ventricular filling at this point. The process is going to continue all the way through until we get back to, and we come back to this point, where it starts going again, and the atria then begin contraction. So we've got atrial systole at this point, ventricular systole perhaps between these points at this point, and then from this point onwards it's diastole. One other thing that you can use this chart for is you can use this to determine heart rate. So if we look that one complete contraction is taking 0.8 seconds, what you can do with that is you can work out what the beats per minute is, and so by doing that you do 60 divided by the time taken for a single contraction, and in this case it would be 0.8, so I believe that's 75 beats per minute. So if you think about this, because one contraction is taking less than a second, you would expect the heart rate to be above 60, and we'd say that anybody that has an incredibly raised heart rate would be considered tachycardic, which is a term that means a high heart rate, and anybody that has a resting heart rate under 60 beats per minute would therefore be considered bradycardic. But looking at these traces, you can work out, in effect, the resting heart rate of these individuals. Okay, hopefully that's been of help.